Welcome to the Gut Centre. My name is Dr. Jim Kantidakis and I am a clinical psychologist and hypnotherapist. I'm also the founder and director of the Gut Centre. The Gut Centre was founded a number of years ago, and with the purpose of the Gut Centre being that we are psychologists and clinical hypnotherapists treating specifically gastrointestinal problems and conditions. These include functional gut disorders and also biological disorders like inflammatory bowel disease. So at the Gut Centre, we are all psychologists and hypnotherapists. We focus specifically on helping individuals who have gastrointestinal disorders like functional gut disorders like IBS, but even biological disorders like inflammatory bowel disease, better manage their condition and also the psychological distress that's associated with these conditions. The area of psychogastroenterology, if you like, is an evolving speciality or a very evolving area where patients are actually not only being treated specifically medically by their gastrointestinal conditions, but also for the psychological distress and their quality of life that is affected by having these disorders. When I began working in this area of GI psychology over 10 years ago, there was limited knowledge and also limited research in this area. However, due to colleagues in the USA and also in the UK, the area of psychogastroenterology is evolving, and now there are multiple clinical studies and a lot of evidence to support its efficacy, which means that it is a very highly effective treatment. It actually does work and help individuals reduce the distress, and that can be anxiety and depression. Also, better help manage the symptoms, especially for people that have IBS. When patients come in to see me, the first thing I say is, this is not in your mind. You're not creating it, you're not faking it. It's essentially not your fault. And then I'll go on to explain to them why psychological therapies, for example, something like gut-directed hypnotherapy, for something that is a very physical condition, like IBS. And the answer in this lies in what we call the brain-gut axis or the brain-gut connection. And so, in a very simplified way, the way I explain this is that, the brain and the gut develop in the same area of tissue in the embryo, in the very early stages of development. And as the embryo of the fetus grows, the brain goes up one end. There is a migration of neurons or nerve cells that go down towards the GI system or the gastrointestinal tract. And the brain and gut are connected then by the vagus nerve. There's a lot more connections than that, but we'll keep it nice and simple. Because they develop from the same area of tissue, they share similar neurotransmitters. Dopamine and serotonin are some of the main ones. So essentially, the brain and gut are constantly communicating to each other. The gut, or the digestive tract, has just as many nerve cells as the spinal cord does. It has its own nervous system. It's called the enteric nervous system. It doesn't necessarily need the brain to work. It can work fairly independently of the brain. Now, our emotional brain is connected to our gut, which is why we get the saying, butterflies in the stomach, or that experience was gut-wrenching, or, as I joke with my patients, that person gives me the shits, pardon the language, but, so we all are aware of this. We all have this experience. It is quite normal. However, in patients or individuals that have IBS, they have what we call visceral hypersensitivity. So essentially what that means is that their digestive tract, their gut, is really sensitive. So stress and even foods are going to have a stronger reaction to the gut, or the gut's going to respond inappropriately or a more exaggerated way to stress and to foods. The communication between the brain and the gut is actually bidirectional. What happens here affects here. What happens here affects here. Scientific research now is actually showing, and has been showing for a number of years, more recent years, that the brain does actually play a part in the gut. It's not just diet that affects the gut. And what they found in these neuroimaging studies, which are studies that are looking at the brain, is that patients or individuals that actually have functional gut disorders like IBS show ineffective pain modulation, which means that it's a misinterpretation of signals. Increased pain amplification. In other words, what might be experienced as a minor symptom or discomfort in someone who doesn't have IBS, the patient with IBS will experience a severe pain. And again, as I mentioned earlier, visceral hypersensitivity. So their gut is very sensitive to food and to emotion. So they're going to overreact to what might be a fairly normal or fairly mild stimuli. There is extensive research looking at the efficacy or the usefulness of psychological treatments in helping people treat gut disorders like irritable bowel syndrome or functional gut disorders. A lot of the research is actually looking at what we call cognitive behavioral therapy. And what cognitive behavioral therapy is, it's a psychological therapy that's been used over a number of years, many years in fact, a way of treating and helping people better manage anxiety or mood disorders. Gut-directed hypnotherapy is nothing new. It's been around actually for a long time. It actually is traced back to the early 1980s by a Professor Peter Warwell. And Professor Peter Warwell was actually a training gastroenterologist when he actually came across hypnotherapy, and he thought it might be useful to use this treatment, hypnotherapy, to help his patients who have irritable bowel syndrome or IBS. For more information about that, I do have a podcast, and I have actually interviewed Dr. Peter Warwell, who I know quite well. Getting back, around that time, as I said, he was treating patients with IBS, and he was finding that the general treatments such as medication and so forth were not really helping all that much. And because he had an interest in hypnotherapy, he thought he'd try it on some of his patients. And he thought, wow, this is interesting. Some of his patients were actually improving. So he set up a study back in the early 1980s where he got a number of participants or individuals or patients or participants, and he did hypnotherapy on them. To cut a long story short, he found that of those individuals, approximately 70% of those patients who did the hypnotherapy treatment compared to control experienced a reduction in pain, bloating, and they had also improved bowel habits, so their bowels improved. This study was published in The Lancet in 1984, which from a research perspective is really exciting because The Lancet, I think, is the third most prestigious medical journal in the world. Now, because it was published in The Lancet in 1984, obviously hypnotherapy being a treatment for a medical condition like IBS sparked a lot of interest and a lot more funding. So he went on to develop more research. To cut a long story short, there are a number of studies that come out of Manchester and also out of our friends and colleagues in America, especially Oluffa Poulsen, who also in the early 80s developed a treatment or extended upon this treatment of looking at hypnotherapy for IBS, have found that hypnotherapy is actually a very valid treatment in the treatment of functional gut disorders like IBS. The research in gut-directed hypnotherapy has now been replicated multiple times around the world. It is now considered to be evidence-based treatment in helping individuals better manage the symptoms of IBS and other functional gut disorders. It is actually a medical hypnotherapy. There is no loss of control. There is no chicken dancing, as I'll joke with my clients. There is complete awareness. So the aim of the therapy is basically to help our patients get back in control, not to take control away from them. And they're aware the whole time of what's going on and what's being said. Hi, my name is Dr. Jim Kantidakis, and I'm a clinical psychologist and hypnotherapist, also founder and director of the Gut Centre here in Melbourne and also in now Sydney.